Hello, everyone. Good evening. It's 9 o'clock, and we have a very weighty, policy-heavy session ahead of us. So I hope you all have had a little caffeine, but I hope it proves a good experience for you, too, a good learning experience. So I'm Jenny Dyer. I'm the Executive Director of Hope Through Healing Hands. We're one of the sponsors for this great medical missions conference that we heard about a year ago from Dr. Paul Osteen, and was excited to see this finally come to fruition a year later here. For Hope Through Healing Hands, our founder and our chair is Senator Dr. Bill Frist. He was the former U.S. Senate Majority Leader. I have worked with him for about 8 years now, and he's been out of office for about 8 years, doing this humanitarian bipartisan work where our leading flagship program is our Frist Global Health Leaders program, where we send medical students, nursing students, and public health students and others out into the field to do clinical work on rotations, essentially, or over a 3 to 6 month period. But beyond that, we do advocacy as well, particularly right now around maternal and child health and healthy timing and spacing of pregnancies. And I work with these guys right here almost on a daily basis. I want to introduce Porter Delaney, who's going to speak first this evening. Porter and I have worked together for about 15 years, particularly in the role around advocacy for HIV/AIDS and in extreme poverty. We worked together with the Data Foundation, which became the One campaign, and I was working on faith outreach, working more inside Washington, and he represents the Kyle House group. Some of the questions we're going to look at tonight are: how do we shape policy? How do we shape the politics, which does shape policy, particularly for global health? And we're going to look at the case study of AIDS from about 2000 to 2010 and what that looked like. But even more specifically, we're going to look at the faith community and how the faith community played a critical role in shaping policy and legislation for global health, particularly on HIV/AIDS and other issues as well. Tom Walsh, Senior Program Officer of the Bill and Melinda Gates Foundation, his background is with PEPFAR, and I'll let him speak to that a little bit in a moment, but he'll talk a little bit to the implementation of faith communities, of funding with that legislation in PEPFAR, so looking at the faith community as service providers. And I will wrap up with, so now what can we do today? So here is Porter Delaney. Welcome, Porter.
Thank you, Jenny. So I'm going to buzz through this PowerPoint somewhat quickly, but the goal that I have for my 7 to 10 minutes here is to give you a little bit of a primer as we're talking about what the U.S. government does on global health and their leadership. Just to start off a little bit looking at what does that look like, what are the areas where the U.S. government focuses, what kind of funding commitments do they make. My experience, as Jenny said, the last 15 years has been as a professional advocate in Washington, D.C., helping to work on teams of campaigns around a variety of global health issues, everything from HIV/AIDS, malaria, nutrition, a variety of also other global development policy issues. And just skipping through here in the health space, so I won't read through this, but it gives you a feel for, these are the core areas where within the U.S. government we focus our programs and our resources. You can see basically dividing this up into disease-specific programs, a lot around infectious disease on the top, and then more population-based maternal newborn child health, which will be a focus of what we'll talk about in terms of the work that we do now. And this is a bit of a team ourselves, and there's many others involved, as Jenny alluded to, has really been around global maternal newborn child health and this issue of healthy timing, spacing, and pregnancy. So in this second piece here, I'll talk a little bit about that. And I won't spend too much time, because this is kind of a scary chart, but just giving you a feel, again, for global health really cuts across a variety of agencies and offices in the U.S. government. We do lead programs, as you saw in the last slide, in a broad diversity of areas. And so from the State Department to USAID, which really leads a lot of our efforts, to the Department of Health and Human Services, which has CDC, NIH, and others, these programs we're talking about cut across this broad government apparatus. And then if you have a chance to sort of quickly peruse through this, what you'd see really is the last 15 years, and really even from 2000 to 2009 was a sort of a revolution, if you will, in terms of increased investment from the U.S. government in global health, much of which was around HIV/AIDS, which we'll talk a bit about because the faith community plays such a central role in terms of creating the political energy for the U.S. government to lead on fighting HIV/AIDS. And as I said, we'll come back to that, but you could see other sort of moments here. So back in 2003 was when this big AIDS initiative was launched in the State of the Union. It was a 5-year plan. So in 2008, Congress authorizes these programs. It had to be reauthorized again in 2013. Last year, as you're probably following, was a big year in global development in terms of the UN Sustainable Development Goals, much of which, again, was focused around global health, and a lot of U.S. government commitments will be in alignment with that. This is a really important slide because it shows you, even though it sounds impressive when you hear the U.S. government spending close to $10 billion excuse me, a year on global health, that's such a really teeny fraction. It's less than it's really about 1% of the federal budget. And as you'll hear from us, and you probably know yourself from your experience, that 1% has achieved some pretty remarkable things. And even just the space of time I've been able to work on this in the last 15 years. But this does just show you again what a modest investment this is that we as taxpayers are making. And these are the numbers I just mentioned, about $10 billion a year. If you went a little further back, I was sort of saying this has been kind of a revolutionary period. Around 2000, 2001, we were really just at $2 billion a year. So we increased global health spending because of advocacy, because of the voice of the faith community and others, increased it by a factor of 5 in a period of really just 7 or 8 years. And so when you hear about the amazing results we've achieved on HIV/AIDS or maternal child health, nutrition, of course it takes resources to achieve that. And that's a lot of what we work together on, just finding a way in a difficult partisan political environment, a financially constrained environment, how do you maintain those resources, those commitments? And one of the challenges is that if you look at foreign assistance more broadly, which still, again, is less than 1% of the budget, so that's not just health, but other areas of investment, agriculture, other areas, disaster assistance, humanitarian response, et cetera. The perception, if you go around America and ask how much money do we spend on foreign assistance, your average American thinks we spend about 25% of the budget on that, when again, you've just learned, and you saw the chart, it's less than 1%. And so, some of this is rooted in misperception in terms of building a support base for global health. I'll go through these quickly, but I've talked a lot about these different agencies. The State Department is the big one here because, as you'll see in the next slide, HIV/AIDS is by far the biggest piece. Tom Walsh, as you'll hear from, served as Chief of Staff, helped to lead the organization which is called the Office of the Global AIDS Coordinator in the State Department that coordinates, as it sounds, all these investments we've been making in HIV/AIDS, but that was been the biggest piece of these large increases in global health. But you can see the other areas here: maternal newborn child health, malaria. The Global Fund is a multilateral mechanism in Geneva that the U.S. is the biggest contributor to, which is focused on HIV/AIDS, malaria, and tuberculosis. And then this just shows what an important role the U.S. plays. So if you look 2002, 2012, our role has grown. So really more than a full third of global investments from the public sector, from governments, is coming from the U.S. government. Some shifting around in terms of other players in that time period. So World Bank used to be a big player. Now this Global Fund that I mentioned in Geneva, because of its large investments, has become a bigger player. Sorry for the changes in volume here on the microphone, but this just shows you by some of these specific investment areas who are the lead players. And again, when you see the Global Fund, remember that the U.S. is the biggest contributor. So when you see them leading on malaria or TB, that is largely due to U.S. commitments. And in the other areas, you see the U.S. leading. And then on the issue that Jenny talked about, healthy timing and spacing of pregnancies, which really is an element of our family planning programs, this shows you roughly what we're spending on that. So about $600 million a year. Significant resources, certainly the most in the world, but vis-a-vis some of the other investments like HIV/AIDS, which are between $5 and $6 billion, this is more modest. You'll hear from us, we think this is a great area to achieve more gains in global health in terms of reducing maternal child deaths. And this again just shows in the space of family planning, the U.S. being the biggest contributor. So I'm going to do this very fast because I'm probably already almost at my time, but I wanted to just touch on a couple of points from my experience about what are the key ingredients to successful advocacy. And I'll tie it back quickly at the end of the faith community because I think the faith community is really sort of infused in all of this. So presidential leadership, and this is looking at, I'm going to look at PEPFAR, again, this President's Emergency Plan for AIDS Relief, largest commitment ever made in the history of mankind. in global health towards fighting a single disease, which again was in President Bush's State of the Union address in 2003. This is him signing that first bill into law, bipartisan members of Congress. Jenny's chairman, Majority Leader Bill Frist right there behind him, among others. And truly a bipartisan effort. Global health is really unique in that you hear all the partisanship every day. Health programs have always, the 15 years I've worked on this and this kind of revolution of increased spending, enjoyed very strong bipartisan support. So in this case, our now Secretary of State, but at the time, Senator John Kerry, and then Senator Bill Frist came together 2 years before this program was launched and introduced legislation together. And then you couldn't find two more polar opposite senators in the political spectrum. Dick Durbin is a very liberal leader of the Democrats, and Rick Santorum at the time was a very conservative senator. The two of them worked together every year to ensure that the U.S. led in our contribution to this global fund to fight AIDS, malaria, and TB in Geneva, and we're very successful in doing that. They also had our boss, an Irish rock star named Bono at the time, helping to keep them together when politics tried to drive them apart. So you can see him here, the top left, with Bill and Melinda Gates, as they were the Time People of the Year. And this is just to speak to, again, these broad coalitions that you need. So you see Rick Warren, you see NGOs, faith organizations, all needing to come together to build this fabric that's necessary to create political will and to maintain commitment. And then the private sector as well, very important. So maybe you're familiar with Product Red. This was something that Bono and One got started, where as consumers we can be activists, and if you buy red Gap clothing or red Starbucks cups of coffee or red iPods, you're contributing to the global fund. And I don't have time to get into it. I'll just say that in the beginning of the PEPFAR program, it was really incumbent upon the pharmaceutical industry to work together to try to bring down the prices of drugs, come up with expedited reviews for generic drugs as well. This, of course, is really hard to consume, but I'll pick out one or two results. PEPFAR, again, the example we're pointing to, the baseline from when this program started, only 50,000 people on the continent of Africa having access to the treatments that they needed. And today, with U.S. leadership, 9.5 million having access. And what that has accomplished, not just in their lives, but of course their families, their communities, their countries, with, again, quite modest investments, $5.5 billion, $6 billion a year. It sounds like a lot. And a $4 trillion a year budget, those are peanuts. Yet what it achieved is pretty remarkable. In the last 25 to 30 years, we've seen globally maternal and child deaths cut in half. There's still way too many. We've got a long way to go, but that's been a remarkable success. I won't go to any of these others just because there's too many there, but if any of you are interested afterwards, happy to give you this presentation if you want to take a closer look at it. And then, some goals going forward. How do we maintain U.S. leadership? This is the core of advocacy. What role can the faith community continue to play to make sure that our government focuses on these issues, to take the politics out of it and focus on sort of the moral obligation we have to lead in terms of saving these lives? I mentioned last year the UN Sustainable Development Goals, the way forward on that. And then lastly, globally coming up with sort of a framework through which we can finance global health. So with that, I'll hand it off to my colleague, Tom Walsh, who can talk some of his great experience both in the U.S. government and now at the Bill and Melinda Gates Foundation.
Thank you, Porter. So my name is, as Porter said, Tom Walsh. I'm with the Bill and Melinda Gates Foundation. I hope you will excuse me from glancing down at my Windows phone for my notes. I really should have in the notes what my name is. I actually woke up this morning in Berlin, Germany, and after 16 short hours of travel, I'm delighted to be here with you, wherever I am and whoever you are. So, to put a little perspective on this, and this, what is this panel doing here at a global medical missions conference? I think our desire to bring this was to really shine a spotlight on advocacy. So I think many of you are involved in very heroic activities in the missions field, and certainly we got a glimpse of that in the session we were just in. And what we're talking about here is really not very heroic, really. Being an advocate is really not something you need to stop doing what you're doing in order to do. It's something you can add onto what you're already doing. That can really augment and amplify the impact of what you're doing. So it's just a very different thing than most of what we'll be talking about over these 24 hours. But also I want to convey that it's an important one, and as it makes a real difference, and that you kind of in whatever role you are have the potential to be part of that. So, you know, as I mentioned, I'm from the Gates Foundation. So the Gates Foundation is the largest philanthropic foundation in the United States, and our major focus is global health. And so we are investing a great deal of money in things like development of new vaccines, new ways to deliver existing things to the field, very sciencey kind of stuff. We do some other things beyond health, improving agricultural productivity to try to bring the green revolution to Africa, for example, working on financial services for the poor, some other things. But global health is by far the biggest one, and so within that we focus mainly on infectious diseases. I'm a little embarrassed to say we don't do the non-communicable diseases like heart disease, but you know, maybe, clearly there's a need there, as we learned this evening. But I think when Bill and Melinda Gates, and I should say, we are a secular organization, much like the U.S. government, where I used to work, is a secular organization, certainly one that has a lot of Christians in it, but both of those do. But I think one of the things that Bill and Melinda Gates found once they had established this and it was doing the field work was that they had a lot of advocacy. They were leaving a lot of their potential impacts kind of on the bench if they weren't also engaging in advocacy. I don't think that was really what they saw them, you know, had a particular attraction to. I think they really were more into the technical kinds of stuff. But they began to realize, well, as big as the foundation is, it's always going to be dwarfed by what the U.S. government is doing on global health, by what other large donor governments are doing. And so that they needed to start to use their voices and kind of speak on behalf of the people in poor countries who need advocates here. It's been, I think it's one of the things that is hard to keep in mind, but is very important to keep in mind, is the big picture, that the world has gone from having, just to cite one statistic among many, to show the accelerating pace of improvement of global health. In the last generation, since 1990, we as a world went from having 6 million children under age 5 die to now having 3 million a year die. So, and this is in a time when the world population has been markedly increasing. So I mean, we could go on, but I think this is something that people outside the health field often don't really have a sense of, is that there are huge breakthroughs that are happening, tremendous progress. But a lot of it, frankly, has to do with those charts Porter was showing before about the investments of the United States in particular. The first decade of the century was a decade of huge increases in U.S. investments in things that are keeping many people alive. So the faith, and you heard a bit from Porter about how people of faith, and especially Christians in this country, were a big part of helping PEPFAR, President's Emergency Plan for AIDS Relief, and also the President's Malaria Initiative, both get launched about 10 or 12 years ago. Another piece of that, though, is the role of faith implementers in the field, in developing countries. Just as we heard from earlier this evening, so much of the health care, it's often estimated at 40 to 70%, depending on the country, of healthcare in Africa is delivered by faith-based organizations. So there really began to be a wonderful partnership between the U.S. government and faith organizations like a World Vision, like Catholic Relief Services, like many others, to Samaritan's Purse, to get the life-saving things that people needed. So there is a great history of partnership, and I guess I'm here. My role, really, among the three of us tonight, is to be an advocate for continued partnership and to have people who are here as believers really look favorably on what other sectors are contributing to this, and to kind of have a vision where all of these pieces need to be in place for things to happen. Some of the things governments can do, government donors like the United States, is really to do things on a large scale. I know those of you who are working in the field will often feel the constraints of the small budgets you have and the need to really stretch every dollar that's donated to you as far as it can go. Not that it shouldn't be the same ethos for our tax dollars that go to the government, but the reality is this project of getting 9 million people on treatment in Africa, that's not something that I think it didn't happen until the U.S. government stepped in with tax dollars from the people of the United States to make it happen, and now it's happening. So there's really a need for everyone to be pitching in, and part of how you can pitch in from your perspective as people who care about global health is to be champions, is to be advocates. Our members of Congress are constantly going to town hall meetings where they will hear people say, why are we spending a third of our budget on foreign aid for other countries? Of course, we in this room know it's less than 1%, but they are getting flack for supporting these life-saving programs, and there's a need for people to counterbalance that and actually say, no, that is money well spent. I want that less than 1% of my tax dollar to continue to go to save people in Africa, in Asia, in developing countries. So your voices are very important. And again, as I said, it doesn't need to be a full-time job. This is something you can do in addition to what you're doing. And indeed, the more involved you are in health work, the more credible you are as a voice for this. And so that's another thing I sort of want people who've made the commitment to come here to understand, is that even if you don't think of yourself as a big or an important or powerful person, you can meet with your members of Congress. They work for you. You can start a conversation with them, and ideally a recurring conversation where you touch base with them from time to time and just let them know that these are things that matter to you. If Bill and Melinda Gates can find time to do it, why can't we? So I think part of what I want to leave you with this thought is that even if what we're talking about here are not going out and doing huge heroic things, you have the power to help the people who lead us do heroic things, even if heroism doesn't seem to be the order of the day in politics. This is one area of bipartisanship where a lot of great things are being done, kind of under the radar, without a whole lot of attention. And those of you in this room have the ability to help them continue to happen. So now to tell us a little bit more concretely about how you can use a faith voice in doing this is Jenny.
Thanks, Tom. Thanks, Porter. So as I'm sitting over here, I was just reminded as I looked out in the audience and I saw Dr. Dick Furman and Ken Isaac of Senator Frist's role in Congress, and he would go with Dr. Furman to South Sudan and work in a clinic there in Louis, and he would come back with these photos and he would put them on the desk of George Bush, and he would say, there's a pandemic going on in Africa, and this is a real issue, you need to take a look at it. And that's just one small little example. Of course, he was a senator in the U.S. government, but he was doing the work of advocacy, and that is the role we can play too, right? It's just simply lifting our voice, signing our name on a document, letting our congressional members know that you support them, you're behind them, and that you are happy for 2/3 of 1% of your taxes to support global health, because those pennies to the dollars are some of the best U.S. money we spend in terms of saving lives, saving the lives of mothers, saving the lives of children, saving the lives of communities around the world. So today we have offered you the opportunity to do just this, to practice advocacy. I can preach a little bit about advocacy. In Proverbs 31, King Lemuel's mother comes to him and says, speak up on behalf of the poor, speak up on behalf of the destitute. She was asking him to do the work of advocacy. We've offered today a postcard, and you probably have one. Do they have the postcards? Okay, in the books. And the postcard is already set up for you. Take a look at it, read it. In this case, we're supporting the lives of mothers and children, asking to support funding to protect and increase funding and foreign assistance around maternal and child health and healthy timing and spacing of pregnancies. So it has a little space to put either your senator or your representative. If you don't know who that is, that's fine. Just put your zip code. We'll figure out who that is. Sign your name, and Porter in Washington will hand deliver your card, I'm not kidding, to the desk of your congressional representative or senators as he's on the Hill, doing this work, challenging these members of Congress daily to champion some of the most vulnerable populations on the planet. So we've offered you this opportunity. If you're able to sign the card, there's a table over here. We'd welcome you to just drop off your card at the table. You can read a little bit more about the work we're doing at hopethroughhealinghands.org, at our faith-based coalition for healthy mothers and children worldwide. We'd love for you to be a part of that. We'd love for you to look at the other ways you can advocate by other kind of letter writing, making phone calls, this kind of thing, and awareness raising as well in your own communities. Any last words from you guys? Okay, we would love to open the floor now to Q&A. Any questions this late night? Sure.
This is just maybe just a personal thing I'm just curious about. Like, what is the majority of our domestic spending used for? Because if we ask for more, right, someone's going to be losing something. Like,
do you
where
have
do you
the
think we
slide?
should be cutting? Just because I was just curious.
Sure. Do you have that slide? Oh, but yeah.
So you're asking in terms of on the domestic side, basically like how to carve out room for more funding for global health. I guess my short answer would be, in the budget the size of the U.S. government, I think we have the ability to do lots of different things, and it's about prioritization. So usually when we're talking in Congress, it's you're thinking of a process, right? So the president puts a budget forward after the State of the Union every year, and that is the starting point, and then Congress responds to it. And so we sort of work throughout that whole year, as do advocates, of trying to get the president to offer a bold request and then get Congress to support it or increase it. They are tight financial times, but honestly, like, you wouldn't see in our advocacy materials identifying other areas to take that money from. I've been doing this for 15 years. I think that's okay from the standpoint of, there are plenty of champions in Congress on both sides of the aisle who prioritize this. They just oftentimes feel, as Jenny said, that they don't have the support in their constituencies. I mean, what you need to remember when we're showing you global health programs, the constituency is overseas, right? But the faith community is here. And so the faith community is a domestic constituency for global health. And I think that's an important thing to remember. I don't know if anything else you'd want to add, Tom, or...
Only that you're allowed to advocate for this stuff without saying what should be cut to make up for it. It's not, you're not the president, so you don't have to make those trade-offs. And many of the other people who are advocating for other things are also not saying where it should come from. So I would say that's a hard question, and I bet if we went around the room, everybody would think of different things, but don't let that stop you.
So if you didn't hear, Steve's question was, with the advent of the Sustainable Development Goals, which were just pronounced, I guess, in this last September, where is the room for anesthesia, surgery, these kinds of things, in addition to the larger global health issues that we've been talking about tonight, HIV, AIDS, malaria, clean water, maternal and child health, and funding, potential funding sources for that. Do y'all want to? speak to that.
Yeah, Steve, I don't know if I have the sort of the perfect answer for you. I mean, some of it is, and Jenny said this before, and Tom and I both said it, we want to carry the conversation forward, so maybe I don't have the exact answer for you now in terms of which program, which account, but I do believe in these resources and in these programs there are opportunities around the important areas you're describing. So if I can offer you as an answer, let's follow up and we'll work together on it. That's what I would say.
Yes. Okay, so who determines how funds are distributed and how are they broken down and who decides which country they go to? This is a complicated response in the fact that there's numerous accounts going to numerous countries. Do you want to?
Well, it's complicated. Okay, so there are a number of different specific funding, specifically funded programs. So, for example, PEPFAR, the AIDS program, all that money is allocated to HIV/AIDS. It has a particular line in the budget. President's Malaria Initiative. There are a number of things that are in these disease-specific programs, and then others that are part of a more general pot. But then the decisions are really made by the executive branch of the U.S. government. The main foreign assistance agency of the U.S. government is called USAID, the U.S. Agency for International Development. And they are subject to some earmarks from Congress that try to influence the decisions they make. But in general, it's really USAID that is making the decisions about how to prioritize among all the different diseases and conditions they are addressing in all the countries of the world where they have programs. It's just a big complex kind of trade-off. It definitely changes over time. That's one thing I would point out. So, for example, USAID has reduced its funding for Latin America quite a bit because Latin America has experienced a lot of economic growth and still falling far short, but its health systems have been improving at a more rapid rate than those in Africa. So I would say U.S. Global Health Assistance has become much more Africa-focused in recent years, but there are still significant programs in various countries in Asia and the Americas. I mean, Haiti being an exception, a country in the Americas where there's still a lot of U.S. money being programmed. So I hope that suffices to give you kind of a general answer, but it's really complex. And I'll give you, yeah. Yes, that's how it works. So her question was, as disease burden changes over time, does the government then change its funding to reflect that? And yes, is the answer. So an example of that in the HIV space would be a country like Rwanda. Well, Rwanda and Ethiopia are a bit unusual in that their cases, they have less of an HIV burden than was thought when PEPFAR was launched. But as a result, money has been directed away from those countries to some other countries that have that we now understand to have more of an epidemic, a less controlled epidemic. It's a very ongoing annual decision-making process with a lot of data, reflecting disease burden, but also the economic ability of the country to meet its own needs. So for the countries in Southern Africa, like South Africa, Namibia, Botswana, that are relatively developed, are able to put in more of their money. So the U.S. funding has gone down and been redirected to other countries like DR Congo that don't have that same ability.
Okay, I think we have 1 or 2 more minutes 5 more minutes. Oh, good. Okay, so we can take 2 more questions. Yes. Okay. So the question is, in the past where we've worked with the pharmaceutical companies in the private sector, now can we think about working with the biotech industry? How can we advocate for more of their implementation in low resource instruments, low resource settings? I know that Senator Frist has worked with the GE Foundation, and we have worked with providing some innovative equipment in Kajabe Hospital in Kenya with a team there that we knew quite well and helped bridge that relationship. And that's one good example, and that was around anesthesiology. Porter, do you want to speak to the private sector? Or?
I don't have, honestly, a sophisticated answer as it relates to, particularly around biotech, but I very quickly in that, speed PowerPoint presentation alluded to the consultations, really the partnership that was necessary with the brand pharmaceutical industry around creating expedited reviews on generics. And I think, so if the government is $10 billion a year in global health, and that's much bigger than what sort of individual NGOs or faith-based organizations can do. Of course, the private sector dwarfs the U.S. government, and so finding ways to incentivize industry to lead is really important. And I would say that a specific example I could share with you, when Jenny and I were working with the One Campaign and with Bono doing advocacy, we did a lot of work with now Governor of Kansas, Sam Brownback, then Senator, who actually was somewhat hesitant around these issues in the beginning, became a champion on global HIV/AIDS, malaria, and TB, and then he started advocating to Bono, lobbying him the other way around, saying, hey, I want you to sign on to this letter where he was focused on neglected and tropical diseases, and he wanted to create a sort of market incentive whereby if a U.S. Biotech or pharmaceutical company created a new vaccine for a neglected tropical disease, they would get an expedited review from the FDA of their next Lipitor. So giving them a financial incentive and a market-based incentive to create, a new technology, a new solution. That's not specific to your point about biotech, but I think it speaks to the broader question of the role of the private sector. I mean, Tom could tell you about how the Gates Foundation, Bill Gates, played a key role in what's called advanced market commitments, and how they created a market where it didn't exist, again, more broadly for new vaccines around pneumococcal and rotavirus, two largest killers of children under the age of 5 in the world, and just brought vaccines, millions of vaccines across all sorts of countries. And so that's speaking more generally to your point. I don't know if you know anything else on the biotech front or.
Yeah, we only have 2 more. Yeah, but one more, yeah. Yes, quickly, yes. The mental health issues. Okay, so first question is discussion around mental health as it pertains to global health issues and policy.
You mentioned that you can do advocacy on the side. What about for us who want to actually work full-time?
Speak to us afterwards and we can figure out a job for you. So hold on. Okay, so we'll tackle this first and I'll help you with your job situation next. So do y'all want to speak to mental health issues?
I'll say a little bit. Mental health, I think, is a little bit like the other non-communicable diseases that this gentleman raised earlier, in that they really are not a focus of the U.S. programs overseas right now. I think everyone would agree it would be great to get to a point where U.S. funding has increased to the level where we can start to take on these other things that we know here in our domestic experience are very much problems. There was a couple of articles in the New York Times a few months ago that are worth just Googling and reading. I mean, absolutely hair-raising stories about mental health. People suffering with mental health issues in Africa, and people being just chained to trees, kind of more or less indefinitely because there's nothing else available. It was really heartbreaking. That story did, in fact, have some hope. It did find some positive models, but I think that falls into a category of things that, well, frankly, that I know a lot of faith organizations that really do take a holistic approach are able to address in a way that governments can't, because whether it's funding limitations or lack of fully understanding all the dimensions of the problem. And I bet many of you here who are involved in that kind of work are addressing non-communicable diseases, including mental health. On the other question of how to get into this,
that's a good question. We can discuss that. So I want to end with this. You guys are the heroes on the front lines. We visit the front lines. But we aren't on the front lines. We are not medical doctors. We are not nurses. You guys are there in the trenches, and you have the stories. I mean, there's nobody better than you guys to be advocates. I mean, and I'm saying that with all full authenticity. So we encourage you in this room of heroes to share those stories. Share those stories with your members of Congress. Let them know that you are behind philanthropy, you are behind doing the work of medical missions, but you're also behind the U.S. government, taking a tiny fraction of your tax budget to put forth into a great infrastructure to save the lives of millions of people through global health. We have a book for you, The Mother and Child Project. We hope you enjoy it. Thank you so much.